According to the World Health Organization, infertility affects up to 15% of the reproductive-aged couples worldwide. In most African countries, fertility is prized, and couples without children are made to feel inadequate. I'm with one such couple to know more about their story. It was while she was in secondary school that the abnormality in her reproductive system was detected. She lived in the fear of the unknown of her future. Her parents took her to both orthodox and traditional health centers seeking a cure, but the situation was still bleak. Madam Adoma encouraged herself after several attempts to get pregnant after marriage and decided to fight her problem of infertility. It all began like this.
There were some abnormalities and my parents got to know that this time may cause problems in the future. So way back in 2003, they started treating me. I was bleeding non-stop, and I think it has some medical terms that can be used. I kept bleeding since secondary school, and they detected that it could be a problem.
After the wedding bells and celebrations fades away, the pressure by society, friends and family for Adoma to conceive heightened. She told me that even though she was prepared psychologically and emotionally for the societal pressure, it became depressing and unbearable after 1 year.
When the announcement is made that you're getting married, people start making those comments. Even on the wedding day, they start making pastors, elders, everybody start making comments that a year by this time you should give birth. So you right after they are counting whether you are pregnant or you are not pregnant, that is also a challenge. And people start asking, why are you not getting pregnant? Is it because of school? Don't put school ahead of giving birth. You can give birth whilst in school. Meanwhile, they've not even asked you what the problem is.
In Adoma's case, fighting infertility became easier from day one. She made her husband aware of her condition while they were dating, so they fought the polycystic ovarian condition head-on. Adoma recounts traumatic moments of her visits from one hospital to the other so she could conceive. She explained that treating infertility is very expensive and not all outcomes are successful.
I actually made my intentions known to my partner, and he was okay with it. He had faith in God that everything will work out. So we were even surprised it came out very fast. We were looking up to a 10-year miracle or a 5-year miracle, but God did it so fast. And I don't know whether it was also because of the medical treatment that we took over the years.
After several failed attempts, focus and the never give up attitude, Adoma's turning point to conceiving began. She became pregnant.
When I went, the doctor was really, really accommodating, very friendly. He was encouraging enough. He was positive. First of all, he was very positive that he's seen so many of these cases. Most of them work, but some don't work. But he's positive that in my case it will work. And that alone was a relief for me. Yeah, so we took several treatments that we've taken before in other places. We started with that one again. And because it's a new facility, they want to start everything afresh.
According to experts, infertility is not a problem associated with women, but men as well. Unfortunately, in our part of the world, women are hardest hit when the issue of infertility comes up for discussion. Dr. Samuel Menya is the resident obstetrician gynecologist at the Fine Fertility Hospital in Accra.
Infertility poses a public health threat in that it's becoming a worrying trend in divorce cases nowadays. Here, about 20% of all divorce cases are because families are not able to raise children. It also causes stressful situations to individuals in that it lowers the self-esteem of people, especially women, to the point that it causes frank depression. We have about 8 to 12% of the population having inability to conceive. And a lot of times we blame this on the woman. But this is a problem for both the man and the woman in a relationship.
According to Dr. Minya, there are 3 areas to look out for with regards to infertility in women: the ovaries, fallopian tubes, and womb.
If pregnancy is not happening, on the side of the woman, we look at 3 major things. Now we look at the ovaries, whether it's producing eggs. And there are several causes or several things that will prevent the woman from producing eggs. Common stress. When the woman goes through a lot of stress, it affects her ability to produce and release eggs. Then weight gain, weight loss, drastic weight gain, drastic weight loss. And the use of these nowadays emergency contraceptive pills when you want to prevent pregnancy. Not to say that is bad in a sense, but the frequent use of emergency contraceptive pills will prevent the woman from producing egg at a time probably she wants to get pregnant. Then there's a condition we call polycystic ovary syndrome. This condition prevents women from producing eggs. And women between the ages of 15 to 35, when you see a woman with the hair under the chin, sideburns, and getting a lot of acne, pimples on the chest, on the tummy, having male hair distribution, we call it. And usually these are obese women. Then they lack the ability to produce eggs.
Research has shown that the fallopian tubes constitute about 30% of a woman's ability to conceive. Health experts say most infertility problems in women can be attributed to blocked fallopian tubes, dosing with chemicals, sexually transmitted infections, multiple abortions are some of the causes of blocked tubes.
When the woman's tube is blocked, there's no way the egg will pass through to meet the sperm. There's no way the sperm will even meet the egg in the tube. And some causes are infections. A woman stays off sexually transmitted infection. So you advise her on abstinence, being faithful to one partner, and hopefully the partner being faithful to her alone. Women, yes, they want to keep their vagina and their private parts clean, tight, and nice for their partners. As they do that, sometimes they introduce infections higher up the womb and then they block their tubes.
The question is, how does one know whether or not they are fertile?
For a woman, look out for your changing cycles, for instance. So you know that you're supposed to get your menses every month or every 21 to 35 days. And then it's supposed to last for 2 to 7 days. If you're having a changing trend, if for 3 months you don't get your periods, if you for 7 days you bleed more than 7 days, some of these things should prompt you. If for a whole year you haven't gotten your menses.
According to Dr. Samuel Minya, the use of bleaching pills by women also affects their ability to conceive.
The use of some of these medications and chemical agents also go on to affect her ability to conceive, her ability to produce eggs and then to conceive. Because nowadays we are seeing a lot of women who are less than 40 and who are entering menopause. Menopause is targeted around the average age of about 45. While younger women now are going to menopause, or what we call primary ovarian failure, because of our changing lifestyles.
Getting pregnant before the age of 35 is highly recommended.
Every woman is born with a fixed number of eggs. You're born with about 2 million eggs. By the time you reach puberty, you have about 400,000 eggs. As the months go by, every cycle as you menstruate, you lose about 13 to 30 eggs. Now it gets faster when you get to the age of 40, you have rapid egg depletion, so that by an average of 45, you have just about 10,000 eggs. 10,000 eggs means you don't have eggs. So you should try and get pregnant before the age of 35. At least your first pregnancy should be there before the age of 35.
Being knowledgeable about one's menstrual cycle, regular sexual intercourse at least 3 to 4 times every week between couples, reducing stress levels are also recommended.
So in solving, sometimes we give medications that will help the woman produce eggs. We call it ovulation induction. Produce eggs and then give you a time to have sex with your partner. Other times, when the eggs are being produced, we take the sperms from your partner, wash them, and then drop inside the womb. That's called intrauterine insemination. And then the last resort in fertility treatment is IVF, in vitro fertilization, where we bring out the woman's egg, take the man's sperm, add them, and then the baby that has been formed will be put in the incubator for about 3 or 5 days, and then transferred when the babies are strong enough to survive in the mother's womb.
The duration for treating infertility varies from immediately to as long as several years, depending on the severity of the condition.
You just do mild to moderate exercise. You just sweat every day for 30 minutes. Once this becomes a lifestyle, freely you can conceive, you can get regular menses, and then you release eggs and then easily get pregnant. Well, other times it can be draining. IVF, which is the last resort and which might be the most expensive treatment option, ranges from about $4,000 to about $7,500, depending on the problem. You see, to the point that if we have to do a procedure we call ICSI, intracytoplasmic sperm injection, where we take the man's sperm and then take the woman's egg, one after the other, inject the sperm into the egg.
Adoma has a word about societal pressure regarding infertility.
Issues of fertility are very, very, very sensitive, and they should know how to approach people when immediately after marriage they are trying to pose their nose in people's marriages, asking the question, why are they delaying? And that even some people can go like, you can even get pregnant whilst in school, as if the person in concern is not aware, is not seeing her colleagues pregnant in class, you see. So positive thinkers, you should surround yourself with positive thinkers, and people should know how to handle sensitive issues, and they should also give people with such issues space.
When a couple, both a man and a woman, are stressed up, they produce stress hormones, which also affect the woman's ability to produce eggs. Sometimes also affect the man's ability to produce sperms because they are stressed up. Yeah, so stress from society, stress from work, stress from the family can also go a long way. In this same societal or family pressure, some women will receive medications, over-the-counter drugs. Your friends will tell you, go and buy this drug. They'll tell you, well, I did this treatment, so you too go and do the same. And so some of these indirect pressures or indirect influences on the woman or the man can go a long way to prevent the woman from getting pregnant.
Just like Adoma, many women are quietly dealing with issues of infertility in Ghana. Most of these women cry alone and blame themselves, but doctors are sure that there is hope. Among other things, they advise a reduction in stress levels, eating well plus fruits and vegetables, and regular exercise, not forgetting regular hospital visits for checkups. Health experts also recommend adoption to couples who have exhausted all the treatment plans and still are unable to conceive. Beatrice Sanaju, GBC News, Accra.
Plasmodium vivax. Per the national data, the disease has for many years remained among the top 10 reported health cases at health